Did you know that every 17 minutes, a man dies from prostate cancer in the United States alone? That's more than 85 men every single day. An unsettling truth, isn't it? Prostate cancer is not just a disease, it's a silent killer, lurking in the shadows, often going unnoticed until it's too late. But it's not all doom and gloom. With the advancement of medical science, we've made significant strides in understanding this disease and developing treatments that can help. From surgery to hormone therapy, from chemotherapy to the latest in immunotherapy, the options are as varied as they are promising. The journey to beating prostate cancer, however, begins with understanding the disease, its effects, and most importantly, the treatments available. Every man's journey is unique, and so is his treatment. So today we dive into the 8 types of prostate cancer treatments and therapies, because knowledge, after all, is the best defense. One of the most common forms of treatment is surgery. When it comes to treating prostate cancer, surgery often becomes the go-to option. But did you know there are different types of surgical procedures that can be performed? Yes, indeed. First, we have radical prostatectomy, where the entire prostate gland and some of the surrounding tissues are removed. This procedure is typically recommended when the cancer is confined to the prostate. Next, we have laparoscopic surgery. This is a minimally invasive procedure performed through small incisions. It's generally associated with less pain, less blood loss, and quicker recovery time compared to a radical prostatectomy. But, as with any medical procedure, there are potential risks and benefits associated with each type of surgery. These can range from infection and bleeding to urinary incontinence and erectile dysfunction. Surgery can be an effective treatment, but it's not the only option. Let's delve into the next one. Radiation therapy is another popular form of treatment. It's a powerful tool in the fight against prostate cancer, employing high-energy particles or waves to destroy or damage cancer cells. It works by damaging the DNA inside the cancer cells, making it harder for them to multiply. There are 2 primary types of radiation therapy: external beam radiation therapy and brachytherapy. External beam radiation therapy is just as it sounds. The radiation is directed at your prostate from a machine outside your body. On the other hand, brachytherapy involves placing tiny radioactive seeds directly into your prostate. Like any treatment, radiation therapy isn't without potential side effects. These may include fatigue, mild skin reactions, upset stomach, or loose bowel movements. Some men might also experience urinary or sexual problems. Despite these potential side effects, the benefits often outweigh the risks for many men. Radiation therapy can be a powerful weapon against prostate cancer. Now on to the next treatment. Another method to fight prostate cancer is hormone therapy. This approach targets the male hormones, or androgens, that prostate cancer cells rely on to grow. By reducing the production or blocking the effects of these hormones, hormone therapy can slow or even stop the growth of prostate cancer cells. You might be wondering about side effects. Like any treatment, hormone therapy has its own. These can include fatigue, hot flashes, loss of sexual desire, and others. But remember, side effects vary from person to person. So how effective is hormone therapy? The answer, like many things in medicine, is it depends. It's often used if surgery or radiation aren't options, or if the cancer has spread. And in many cases, hormone therapy can control prostate cancer effectively for years. Hormone therapy can be a game changer for many patients. Now let's look at the next option. Chemotherapy is a treatment option often used when other methods are not successful. It's a powerful tool in the arsenal of cancer treatments. This method involves the use of drugs to kill cancer cells, preventing them from growing and multiplying. This treatment can be administered intravenously or orally. Chemotherapy is typically used when prostate cancer has spread outside the prostate gland, making other treatments less effective. It's often used in conjunction with other therapies to maximize its impact. While chemotherapy can be a game changer, it does come with its share of side effects. These may include fatigue, nausea, hair loss, and a reduced immune response. However, it's important to remember that everyone's experience with chemotherapy is unique. Your healthcare team will work closely with you to manage these side effects and ensure the best possible quality of life during treatment. Chemotherapy can be a lifesaver for patients with advanced prostate cancer. Next, we have a treatment that's a bit different. Immunotherapy is a newer form of treatment that uses the body's own immune system to fight cancer. By enhancing the immune system, it equips the body with a powerful tool to identify and destroy cancer cells. This is much like how our bodies naturally fight off infections and diseases. Immunotherapy works in two ways. First, it can stimulate your own immune system to work harder or smarter to attack cancer cells. Second, it can give your immune system components, such as man-made immune system proteins, to enhance its cancer-fighting capabilities. Although it's a promising treatment, it's not without potential side effects. These can range from mild, like fatigue and nausea, to more serious ones, such as heart palpitations or lung inflammation. In terms of its effectiveness against prostate cancer, recent studies show that it can slow down the progression of the disease, particularly in advanced stages. Immunotherapy is an exciting development in cancer treatment. Let's move on to the next one. Cryotherapy is a less common but potentially effective treatment for prostate cancer. So, what exactly is cryotherapy? Cryotherapy, also known as cryosurgery, involves the use of extreme cold to freeze and destroy cancer cells. It's performed under anesthesia, and tiny needles are inserted into the prostate gland. Then a gas is passed through these needles, freezing the surrounding tissue, and hopefully killing the cancer cells. Side effects can include some discomfort, swelling, or bruising at the needle entry points. There may also be urinary and sexual side effects, similar to those experienced with other prostate cancer treatments. Cryotherapy isn't typically the first line of defense. It's often considered if the cancer is localized within the prostate and hasn't responded to other treatments, or for patients who may not be suitable candidates for surgery or radiation. Cryotherapy can be a good option for certain patients. Now we have two more treatments to cover. Our last two treatments are high-intensity focused ultrasound, or HIFU, and prostate cancer vaccines. Now, let's delve into these fascinating therapies. HIFU is a non-invasive treatment that uses the power of ultrasound to target and eliminate cancerous cells within the prostate. The process involves focusing high-frequency sound waves onto the affected area, creating intense heat that destroys the cancer cells while preserving the surrounding healthy tissue. The beauty of HIFU is its precision, allowing for a targeted attack on the cancer without major surgery. On the flip side, potential side effects include urinary tract infections, urinary retention, and in some cases erectile dysfunction. But the key here is that these side effects are generally less severe than those associated with more invasive treatments. Now let's turn our attention to prostate cancer vaccines. Unlike traditional vaccines which prevent diseases, these are a form of immunotherapy designed to treat existing prostate cancer. The vaccine works by stimulating the body's immune system to attack the cancer cells. One such vaccine, known as Sipuleucel-T, has shown promise in clinical trials. It's made from the patient's own immune cells, which are collected, modified to fight prostate cancer, and then injected back into the body. This personalized approach can potentially result in fewer side effects, although some patients may experience flu-like symptoms, including fever, chills, and fatigue. It's important to note that the effectiveness of these treatments can vary from person to person. Factors such as the stage of the cancer, the patient's overall health, and their response to treatment all play significant roles. In conclusion, both HIFU and prostate cancer vaccines represent significant advancements in the battle against prostate cancer. They offer a less invasive and potentially more targeted approach to treatment, minimizing side effects while maximizing effectiveness. These treatments represent the cutting edge in prostate cancer therapy. So that wraps up our overview of the 8 types of prostate cancer treatments and therapies. There you have it, a comprehensive look at the 8 types of treatments and therapies for prostate cancer. From surgery to radiation therapy, hormone therapy to chemotherapy, and from immunotherapy to cryotherapy, each method offers a unique approach to tackling this prevalent disease. Not to forget the promising advances in high-intensity focused ultrasound and prostate cancer vaccines. Understanding these options is crucial. Not only does it empower you to make informed decisions about your health, but it also opens up a dialogue about a subject that is often shrouded in silence. By shedding light on these treatments, we can demystify prostate cancer and take a step towards a world where this disease no longer poses a threat to our loved ones. If you found this video informative and want to learn more about such important topics, hit that subscribe button. Together, we can increase awareness and save lives. Until next time, stay informed and stay healthy.